It's that flow, no, she my flow. Yeah. It's that
Brain surgery in 3D, coming soon to the operating theater. New videomicroscopes offer astounding images, helping surgeons perform and collaborate on delicate brain and spine operations. One blue surgical drape at a time, the patient disappeared, until all that showed was a triangle of her shaved scalp. 10 seconds of quiet in the room, please, said Dr. David J. Langer, the chairman of neurosurgery at Lenox Hill Hospital in Manhattan, part of Northwell Health. Silence fell, until he said, "Okay, I'll take the scissors." His patient, Anita Roy, 66, had impaired blood flow to the left side of her brain, and Dr. Langer was about to perform bypass surgery on slender, delicate arteries to restore the circulation and prevent a stroke. The operating room was dark, and everyone was wearing 3D glasses. Lenox Hill is the first hospital in the United States to buy a device known as a videomicroscope, which turns neurosurgery into an immersive and sometimes dizzying expedition into the human brain. Enlarged on a 55-inch monitor, the stubble on Miss Roy's shaved scalp spiked up like rebar. The scissors and scalpel seemed big as hockey sticks, and popped out of the screen so vividly that observers felt an urge to duck. "This is like landing on the moon," said a neurosurgeon who was visiting to watch and learn. The equipment produces magnified, high-resolution, three-dimensional digital images of surgical sites, and lets everyone in the room see exactly what the surgeon is seeing. The videomicroscope has a unique ability to capture the brilliance and the beauty of the neurosurgical anatomy, Dr. Langer said. He and other surgeons who have tested it predict it will change the way many brain and spine operations are performed and taught. "The first time I used it, I told students that this gives them an understanding of why I went into neurosurgery in the first place," Dr. Langer said. But there's more to it than just the gee whiz, IMAX factor. The shared viewing makes 3D surgery an ideal teaching tool. In addition, Dr. Langer and other doctors say the device is smaller and much less cumbersome than standard surgical microscopes and provides better light. It can easily be moved and angled to show bits of anatomy that surgeons would otherwise have to twist and crane their necks to see. Two surgeons on opposite sides of the table can work together easily. Standard surgical microscopes are enormous and require a complicated draping process to ensure sterility. Not so with the new videomicroscope, which is covered with just a sleeve that Dr. Langer said can be slipped on like a condom. Neurosurgery can take many hours, which surgeons operating with magnifying loupes or microscopes often spend looking down their neck spent. As the clock ticks, discomfort becomes pain, and over the years chronic injury to the neck and back can be a career ender for some surgeons. The new device lets them operate while looking straight ahead at the 3D screen, using the image to guide their hands. I don't think there's any doubt that it's going to be valuable, Dr. Langer said. But, he added, in the eyes of someone who's more conservative and who's not as willing to try new things, they may not get over the hump and be willing to do it.